falls are the leading cause of death and injury among older adults in the United States. According to the Centers for Disease Control, 1 out of 4 adults 65 and older will fall annually in the U.S. The CDC encourages healthcare providers to utilize the Stopping Elderly Accidents, Deaths, and Injuries STEADI initiative in their practices. A 2019 outcome evaluation found that the STEADI program effectively reduced fall-related hospitalizations. It also found that older adults with a fall risk and a fall plan of care were less likely to have a fall-related hospitalization than those with a fall risk and without a fall plan of care. To facilitate the STEADI initiative, healthcare providers need to screen all older adult clients for fall risk, assess modifiable risk factors, intervene to reduce identified risks by implementing clinical and community strategies. Identifying an older adult's fall risk is an essential first step for fall prevention. The CDC recommends screening patients using a screen such as the 12-question tool, Stay Independent, or by asking the following questions. Do you feel unsteady when standing or walking? Do you worry about falling? Have you fallen in the past year? A clinically significant score on the Stay Independent screener, or an affirmative answer to any screening question, warrants an assessment of modifiable fall risk factors. If a client does not demonstrate a fall risk based on screening, the CDC suggests that the older adult client receive education as a preventative measure, be reassessed yearly or when a fall does occur, and receive a referral for a community exercise or fall prevention program. The type of healthcare setting and the healthcare provider's scope of practice will determine how the healthcare provider assesses the client's modifiable risks. An interdisciplinary approach can be used to gather fall risk information. If an older adult client is identified as having a fall risk, the CDC lists 4 functional assessments to aid in determining modifiable fall risk factors. 30-second sit to stand test to assess leg strength and endurance. 4-stage balance test to assess balance. Timed up and go tug test to assess mobility. Measure orthostatic blood pressure. The CDC also provides additional ways to assess modifiable factors. These include asking the client about medications that can contribute to their fall risk, asking the client about potential household hazards such as throw rugs, pets, and bathroom surfaces, identifying comorbidities such as osteoporosis, assessing feet and footwear, determining visual acuity, determining vitamin D intake. Assessing modifiable risk factors can be achieved by having the client perform an activity of daily living or vocational task to determine which factors contribute to the client's fall risk. Functional assessments allow healthcare providers to give valuable feedback to the client about safety and body mechanics when engaged in a functional task with high fall risk potential. Client education and referrals to other HCP specialists are essential fall risk reduction and prevention strategies. Creating an FPOC and implementing a multifaceted program, therapeutic intervention, are additional effective strategies to mitigate fall risk. The National Institute on Aging divides exercises into 4 categories: strength, endurance, balance, flexibility. However, a comprehensive therapeutic program will include all 4 areas as a means to reduce fall risk. An effective therapeutic program can consist of therapeutic exercises and function-based activities. Clients can gain muscle mass by lifting weights the recommended amount of 2 days per week. An appropriate strength program should be implemented to mitigate fall risk due to generalized weakness. Recommendation 2 of the APTA, Choosing Wisely campaign says, don't prescribe underdosed strength training programs for older adults. Instead, match exercise frequency, intensity, and duration to the individual's abilities and goals. Therapeutic programs should be tailored to the client's unique needs, strengths, and desired outcomes. The first tenet of AOTA's Choosing Wisely initiative states, don't provide intervention activities that are non-purposeful. Purposeful interventions can include having the client complete the following activities: grocery shopping, laundry, yard work, cooking, cleaning, showering, pet care. Function-based treatments that use purposeful activities have many benefits, such as increasing patient engagement, facilitating dynamic movements that recruit the supporting muscles, increasing endurance, improving overall motor performance. The CDC's STEADI initiative provides a plan for healthcare providers to support fall risk prevention, client and healthcare provider education regarding fall risk mitigation, and a client-centered therapeutic intervention can reduce the adverse effects of falls for older adults.